God bless America. Hello, everybody. I am the Talk Radio Protege. This is the Protege program. Welcome back from the weekend. I'm so glad that you're here. Thank you for tuning in. I hope that you'll enjoy this video. And if you do, I hope that you'll leave a like and subscribe. So let's talk about the Jimmy Kimmel test. I'm not going to be talking about this Washington Post story. I want to talk about Jimmy Kimmel's baby, because Jimmy Kimmel, or rather ever since Jimmy Kimmel turned his kid into a political football, people have been scared to repeal Obamacare. And I think that I have come up with a conservative solution, a conservative, empathetic solution to the Billy Kimmel problem. The Billy Kimmel problem is that babies are born in the United States of America with birth defects and this is the leftist talking point, the leftist propaganda, that there are babies born in the United States of America with birth defects that are categorized as pre-existing conditions that mean that those children can never, ever, ever, ever get health insurance, ever, ever, and therefore they die in hospitals. So we need to pass a bill that fixes this problem. And this bill is authored by myself, and it's called the Stop Babies from Dying in Hospitals in America Act. It's also known as the Billy Kimmel Act. And somebody tell me where I can patent that phrase so that I can sell it when somebody tries to write this bill later. But the Billy Kimmel Act goes like this. If a baby is born in a United States hospital with a malady that was undetectable before the pregnancy was carried to term, then the parents are eligible to receive a Billy Kimmel Act loan from the federal government at 0% interest at a minimum monthly payment of the lesser of $50 or 1% of the recipient's monthly income rounded to the nearest 10. And that's the bill. That's all that you have to do. That's all that is necessary to fix the babies dying in American hospitals problem. That's all that we need to do to fix the Billy Kimmel problem. We don't have to overhaul the entire health insurance system. We don't have to keep a health insurance system that's in a death spiral in order to fix the Billy Kimmel problem. This is the solution. I'm telling you, this is going to work. This passes the Jimmy Kimmel test. Now, it doesn't actually pass the Jimmy Kimmel test because the money isn't free, and not every baby that's born in the United States of America is eligible to receive this money. For instance, if your malady is discovered before the baby is born, then it's the parent's responsibility to plan to have that malady addressed once the baby is born. Whether you purchase health insurance for your baby early, or you start saving money to pay for the hospital bills that your baby's going to accrue after it's born. That then becomes your responsibility, because your baby, you knew this was coming. Your doctor told you before the baby was born that your baby was going to be autistic. So it's your responsibility to find health insurance that's going to cover your baby's autism treatment, or save up enough money so that you can pay for your baby's autism treatment. What this is for parents like Jimmy Kimmel, whose baby is born, and on day one the doctor says, "We just found out that your baby has a heart condition and is going to require $100,000 worth of open heart surgery so that your baby doesn't die a week after you take it home." Except you're not Jimmy Kimmel, so you don't have millions of dollars in your checking account. So you need some help from the federal government to pay for this treatment. So you go to the DMV, or you go to the Social Security Institute, or Social Security Department, or you go to a website that we're going to have Google or Facebook build so that it actually works on day one. And you're going to apply for a Billy Kimmel Act loan. and you're going, and assuming you're going to get letters from your doctor that say, we did all of the tests, all of the screenings before the baby was born, and we didn't find any cause of this problem whatsoever. Here's the tests that we did, and here's the results that they had, and here's a signature from my doctor saying that we didn't know that this baby was going to have this malady beforehand. The government sends you a letter back that says, okay, we got your paperwork, you are eligible for this loan, and they write a blank check to the hospital that says, do whatever you have to do to fix this baby, and the federal government's going to pick up the tab. It's trying to rain on me, so I hope that doesn't interfere with the audio too much. Now, this is going to affect the market because nothing happens in a vacuum, especially in the United States of America. So let me tell you how this is going to affect the market. And it's going to hit the insurance companies. It's going to hit the pre-birth companies, the people that are offering the healthcare screenings for your babies. And it's going to hit the hospitals that are doing the deliveries on the babies, and it's going to hit the hospitals that are performing the surgeries on the babies. And this is not a small number. I actually went and looked up the number of infants that died in hospitals in the United States of America, and according to the CDC, it was 23,000 babies. Now, it doesn't say that that's in hospitals, but I'm kind of assuming that because this is infants, that they were all in hospitals. So, here's how this is going to affect everybody. It's going to hit the insurance companies. The premiums are going to go up because the health insurance companies have to cover more pregnancy treatment, more tests and more screenings that are going to be done during the pregnancy before the birth. It's going to hit the doctors that are doing those screenings because they're going to have to increase the number and significance of the tests and screenings that they're going to be doing. And they have to increase the number and significance of these tests because if they don't, then some woman is going to come along, or some parents are going to come along, and they're going to have a baby, and the doctor's going to come to them on day one and say, your baby has this malady, and it's going to require $100,000 worth of surgery. The parents are going to apply for a Billy Kimmel Act loan from the government. The government's going to come back and say, well, we've been told by Health and Human Services that you're ineligible for this loan because the malady that your baby has was detectable before the birth. And so the doctor that was doing all the tests and screenings before the birth is going to have their livelihood sued away from them by these parents because now they're ineligible for their $100,000 loan. And the parents aren't responsible to pay their medical bills, somebody else is, because we live in a welfare state. So they're going to sue the livelihood away from this doctor. And now all the doctors are going to do all of the tests, they're going to do all of the screenings to make sure that no doctor ever again gets sued away their livelihood because they failed to do the test that would have detected the malady that the parents need to get the $100,000 government Billy Kimmel Act loan for. So those costs are going to go up, meaning that the cost of the health insurance agencies are going to go up, meaning that the premiums for the health insurance is going to go up. Now the hospital bills are also going to go up because the post-birth treatment is going to go up. Every baby now that is born in the United States of America with these maladies is going to receive treatment. Not that they weren't beforehand, because doctors do not treat babies because their parents don't have the money to be treated. Hospitals turn people away because they can't pay. Doctors do not turn people away. Corporate hospitals turn people away. Not saying that corporate hospitals are evil, just saying that's the reality of economics when you're running a hospital. That people that can't pay for their stuff, and approach the hospital beforehand and say, I can't pay for my stuff, get turned away. Emergency rooms can't turn people away. Doctors don't turn people away. That's the reality of the country that we live in. So, costs are high for those types of treatment already because people that can't pay get treated and then don't pay. So the people that can pay have to pay more. But now that the government is paying for everyone, these costs are going to go up more. Because when government is paying for everyone, then the people that are doing the math on these payments realize that they could be making more money, which means they can pay their doctors more, they can pay their nurses more, they can pay their executives and administrative and overhead costs more. So they start charging more for these types of operations because the government's going to pay for it. This is the way that the student loan program works. This is the reality of economics. When you artificially increase demand without artificially increasing supply, then costs go up. So hospital costs are going to go up. Post-birth hospital costs are going to go up because these treatment costs are going to go up because the government's going to pay for the costs. Post-birth hospital, which means after you take the baby home the first time, treatment costs are also going to go up. Because I'm sure that Jimmy Kimmel has taken his baby home, or will take his baby home from the hospital, and then take his baby back to a hospital to get treatment for the heart disease that it has. Because that's the reality of some of these situations, is that the baby is treated to a point that it can be taken home, and then it's going to have follow-up visits where further costs are going to be incurred. So those costs are going to go up because the government is going to continue paying for those costs, because we don't want babies to die in hospitals in America. This is the trade-off, though. This is the trade-off that people are going to have to people are going to have to accept if they want 0 babies to die in hospitals in America. We either increase costs for everyone so that no baby ever dies in a hospital ever again, or we accept the reality that some people are so irresponsible that they don't prepare for the reality that their baby might be born with something that could cause them to die in a hospital. This is the reality that we live in. Nothing happens in a vacuum. I don't really know what else there is to say about this. Oh, that's the important stuff that I wanted to talk about. So if you dip out from this conversation now, I don't blame you. Thank you for watching to this point. Please like and subscribe, and I'll see you next time. But I want to talk about one more thing before we move on, because we haven't finished talking about the Billy Kimmel Act. We haven't finished talking about the Stop Babies from Dying in Hospitals in America Act. There's one more thing we have to talk about, and that's what we do if people miss their monthly payments. We've set the bar so low on the amount of monthly payments that nobody should miss a monthly payment. But if somebody does, we have to have a plan in place, because the government is giving money to people expecting to get it back. We're not giving away free money here. We're trying to implement a conservative solution to the Billy Kimmel problem. So what do we do when people miss their monthly payments? Because people are going to miss their monthly payments to see if they can get away with it, because that's what people do. The first time that you miss a monthly payment, somebody calls you from Health and Human Services or IRS or the Department of the Treasury or whatever. They call you, they write you a letter, they send you an email, whatever they do. Maybe all three. And they say, you missed a payment, you missed a scheduled payment that was supposed to happen on this date. You have 10 days from receiving of this phone call to make the payment. If you make the payment within 10 days, then we will forget that you missed the payment, and you will not have a strike placed on your account. If you make the payment, then you don't have the strike. They forgive the fact that you missed the payment, and you go on about your happy life. You miss the 10-day mark, you get a strike, and you've missed the payment. The next time your opportunity for payment rolls around and you miss, so not the second consecutive, but the second time you miss a payment, you get another phone call, you get another letter, you get another email from whoever we put in charge of this. And it says you missed a second payment. You have 5 days to make the payment. If you make the payment, you won't get strike 2 on your account. If you do miss this 5-day deadline, you get strike 2, and you've missed the payment. If you make the payment before day 5, you don't get strike 2, you keep strike 1. You have to make X number of consecutive payments to eliminate a single strike from your account. If you miss a third payment, not third consecutive, just any third payment, you get a phone call that says you've missed 3 consecutive payments. We're going to garnish your wages. We're going to levy against your bank account for the amount that you owe on your payments. Once you've made X consecutive payments, we'll eliminate strike number 3, and you'll be able to make payments on your own terms. They won't be wage garnishments. They won't be bank levies. Once you've made X consecutive payments, your strikes can all be eliminated. You can go to a strikeless account. If you miss 2 consecutive payments, I think you skip strike 2 and you go straight from strike 1 to strike 3. That's the system that I think we could implement to make sure people pay back their loans, because we're not giving away free money. We're trying to implement a conservative solution. We're trying to implement a conservative, empathetic solution to the Billy Kimmel children are dying in hospitals in America problem. Specifically babies are dying in hospitals in America problem. I think that this is it. This passes the Jimmy Kimmel test, but it doesn't pass the Jimmy Kimmel test because it's not free money. It's not socialism. So it passes, but it doesn't pass. It passes the Jimmy Kimmel test for reasonable, actual people, but it doesn't pass the Jimmy Kimmel test for socialists, because the goal is socialism, not babies not dying in America, which is what actually concerns me. It really does bother me that there are Americans that have or are seeking to power and influence in the United States of America, that I guarantee you they want babies to die if it gets people to be more accepting of socialism in America. I guarantee you. I'm not sure about Bernie Sanders, because I just think that Bernie Sanders genuinely believes that socialism is the be-all, end-all of political systems in the world. But I guarantee you, there are sitting senators and representatives in Congress that want babies to die in the United States of America if it gets people to ask for socialism. I know that they say never contribute to malice what you can, never attribute to malice what you can attribute to incompetence. But when it comes to implementing socialism, I don't think these people are incompetent. I don't believe that these people are incompetent. I believe they are genuinely malicious in wanting to exert the maximum amount of control that they can over your life. So thank you so much for watching. I hope that you enjoyed this video. If you made it to the end, if you wanted to listen through the the discussion about how we're going to keep people paying back their loans, thank you so much. I hope that you enjoyed. I hope you leave a like and subscribe. And as always, I hope you have a fantastic day. God bless you, and God bless America.